Welcome back. You're watching Daybreak if you just joined us. And of course, right now we're getting into the agenda. That's our segment every Wednesday. And today we want to talk about HIV/AIDS. And the Ministry of Health last week revealed that 22 adolescents have acquired HIV/AIDS in Kenya on a daily basis, with 6 dying daily. The question is this worrying data for those who've been following the trends, or is it an improvement, or is the situation getting worse? We also know that back in 2017, a study revealed that 48,503 Kenyans died of AIDS in that year. And while there's some good news, there still are a lot of challenges in regards to tackling HIV/AIDS, Trevor, and that's what we want to get to at the moment. Let me just introduce our guests. 2 are here, and we have the other 2 joining us shortly. Dr. Teresa Alwa, who's an adolescent and HIV specialist with UNICEF Kenya, joins us on the program. Good morning, Daktari.
Good morning.
Thank you so much for being here with us. And Rebecca Nyambeki, a program officer, adolescents and young people from the National AIDS Control Council. Good morning and welcome as well.
Good morning, thank you.
We're still waiting for Bernard Baridi's HIV prevention ambassador, and Doreen Kandi Mora, who's also an HIV activist. As soon as they come in, they'll just dive into the discussion. But I'd like to know from you, what more needs to be done to tackle HIV? That's a question we want to ask you. What more needs to be done to tackle HIV? Because we've seen that the numbers are now 22 adolescents acquiring HIV daily, 6 also dying daily. Did we lose the direction at some point? But what more needs to be done from your view? 2 to 4.
That's right.
2 No, you go ahead.
2 to 4 is the SMS line. The hashtag is Daybreak, at Trevor Mbija, at Wahiga Mora, at Citizen TV Kenya, and you can also call in. We'll be scrolling the numbers on the screen shortly. But let me bring in our guests and allow us to get some thoughts on that data, which I must say I was quite shocked when I saw that alert last week from the Ministry of Health. But Rebecca, let me start with you. How bad are those numbers? 22 adolescents. I mean, obviously, losing even one person is a problem in itself. But when you look at the trend, where would you say Kenya is when you hear 22 adolescents acquiring HIV/AIDS daily with 6 dying daily?
Thank you. So the numbers are definitely high. I'm not going to say that we can do better, and we have been doing better, and so that's the truth. Because if you look at the trend from 2015, even earlier, the data just actually says that we're actually making progress with regards to infections, especially among young people. Yes, the numbers could be lower. So as you said, even one life is devastating, but we are definitely making progress with regards to HIV prevention, especially among young people.
Okay, yeah. and can you say with confidence right now how many Kenyans, for example, might be living with AIDS? Do you have any numbers or stats across maybe the counties? What are the counties that are facing the biggest HIV/AIDS infection challenges?
So currently, I can say that we have about 1.4 or so million people living with HIV, and those are the ones that have been tested. And so, I mean, obviously, maybe there are some that have not been tested. Maybe there are some that we haven't gotten to or haven't been able to access the testing services. But of the ones that we do know, as of the 2018 estimates, we have about 1.4 million or so living with HIV. And with regards to infections, I think it's 52,800 new infections every year.
52,800?
Yes, that is for the general population, and that's also according to the 2018 HIV estimates.
Do you have any?
Okay, do we know which people are more susceptible to it? Because there's been a lot of research coming through. I saw others saying that it's in married couples. I saw others that it's in university level.
So earlier on, I think much earlier in the epidemic in Kenya specifically, it was around the heterosexual married couples. Yeah. And so that was definitely where the infections were higher. But I think now, if you look at the data, from the 52,800 new infections in the country, 17,700 are between 15 to 24 years old. So obviously, when you look at that number, it's higher. It's the higher percentage, the ones contributing the highest. The 10 to 19 as well. Yeah. And then also the 10 to 19 is about 8,000, I think. Yeah. And then we have now the ones who are 15 to 24 being 17,700. So the younger people are the ones who are contributing the highest number of infections, and that's where we need to worry. But that's not to say that we leave other people behind, because what will happen is that we'll then move with the young people and then come back again, pick up the rest of the population that we left behind. So, but right now the numbers are saying that the young people are the ones who are affected the most.
Dr. Luar, isn't that strange? Because you'd think that the younger people are the ones who are more informed today.
Well, you'd expect that, and especially being a digital world, you'd expect that there's more information. Yeah. But as Rebecca says, there's also an increased lens on young people. Previously, the adolescents and young person were not seen in the system. You were either a child or an adult. But now that we have a lens, a complete lens on the different subpopulations, then we're actually seeing what looks like worrying trends. But the reality is as Kenya, we have made a lot of progress in terms of reducing new infections. Combination prevention interventions have gone in where it's targeted to subpopulations that are most vulnerable, most at risk. In terms of looking at the numbers, I would not really concentrate too much on the numbers. I would concentrate on the populations right now.
And sometimes I think different organizations have different numbers and it gets confusing after a while.
Absolutely. Yeah. But as Kenya, we commit to use one data source, and that's what, as partners to the government, we come up with the HIV estimates. And that's what we use as our baseline to say, where are we going, how far have we come, what needs to be done differently. Yeah.
And what needs to be done differently? That was one of the things we're asking our viewers.
We're asking her to answer her question.
Yeah, we answer that question because
so
there's more infections coming in.
So what needs to be done differently? I think going back to the basics. When the epidemic started, there was a lot of information that was flowing to the different populations. Knowing about HIV basics, how to prevent, and if you're HIV positive, what you need to do in terms of getting treatment and accessing treatment. And I think that's an area that we can improve on, given that, like I said, it is a digital space, so young people have access to more information, and part of what UNICEF has been doing is trying to figure out how do we get that information out there, and correct information for that matter.
That will actually help those who receive that information. So tell me this, do you think that, and I don't know how long you've been sort of following what's been happening in the world with HIV/AIDS and the numbers in Kenya, do you think that the focus has suffered? Focus on HIV/AIDS because Kenyans are focusing on possibly other diseases such as cancer, for example?
Yes.
What would you say in regards to that? And also funding as well for HIV/AIDS campaigns. Is money still coming in for that as much as what we saw in previous years?
Well, to answer your first question, yes, the focus has been shifting because we thought at some point that, the epidemic has been controlled. Now that as a country we have ARVs available, then the dust sort of settled in terms of, the urgency in which we needed to treat the situation. In terms of just looking at what else can we do for information gathering, I think I would also task the media, for example, how best can we work together as partners in this to make sure that the conversation keeps on going and reaching the unreached especially. So we need to, in the different settings, apart from at national level, what kind of information, like the shows that you have here, what kind of information can seep through to the school-going kids and the ones who are out of school in terms of prevention messaging and just getting to know issues about HIV. A lot of work has gone into what we do with the Ministry of Education, like the curriculum reforms have really incorporated issues around HIV, which we hope will be a continuous form and a sustained form of providing information. Yeah. When it comes to resources, yes, definitely the resources have gone down. We, as a country...
Both locally and internationally?
Locally and internationally. And we need to also figure out how best to sustain our domestic finances and to improve our domestic finances for HIV response. As we know that health has been devolved to counties, so part of the things that we've been doing, working with counties, is to just make sure that there is a lens on HIV and there are resources put aside for the HIV response. And that is a continuous process that we need to carry on.
Okay. Rebecca, speak to me about attitudes.
Yeah.
Especially on within the young people. Has it changed? Is it the same? Is it getting worse? Because now there are those who also assume that because we have antiretroviral therapy, people now are not scared anymore.
Yeah, with regards to young people and their attitudes around HIV, I think that's why we talk about like risk perception. I don't think young people don't think about HIV as something they need to be concerned about, worried about, especially when we talk about treatment. We're like, we'll get treatment, we'll be fine.
In fact, there was a study that they're more scared of being pregnant rather than contracting
so we have
HIV.
Because pregnancy itaonekana. So if people can see that I'm pregnant, I'd rather get HIV where no one can really see that that anything is wrong with me. So there's obviously issues around.
People actually tell you this?
Yes.
Wow.
I'd rather get I'd rather get HIV than be pregnant, because you see, pregnancy, people can see it. Yeah. And so when you hear people talk like that, you then ask yourself, then where does HIV or health in general fall on the things that young people care about? Where does health or HIV fall? When young people are very passionate about politics, corruption, environmental issues.
Yes.
Where is the health conversation coming in? So, and more so HIV. So I think there's that's the issue we have, and also misinformation sometimes, and there's issues around how we communicate to them. Where are they? What do they care about? And how do we reach them with messages that actually answer the questions they need answered? So then we start asking ourselves, then, if we are solving HIV issues, what do we need to fix for the young person first?
Do you see, sorry, there's so many questions on this issue of HIV. Do you see a perspective where the communication style needs to change, so that it's not just drumming down that don't do this, don't do that, chill? How are we supposed to change this conversation?
I think that times are changing, and with young people more so, we need to be very open and start speaking about sex and sexuality at an earlier age. Because I feel that, at my age, I don't think anyone did speak to me about sex, because if you're 15 to 24, how are you getting HIV?
It means you're
engaging.
Truth is,
you're probably engaging in sex, but who has spoken to you about protected sex? Who has said that maybe my child now is, because we're having as young as 12 engaging in unprotected sex for whatever reasons. It could be that it's a community member through sexual gender-based violence. It could be that they actually engaged willingly, but they did not know what they were getting into. But it's because we're not speaking to them, we're not telling them what they need to hear. And then comes in the roles of the different sectors, because this young person is more than just their mom or their dad at home. It's more than just their teacher. So there's everyone else around them, and what are we doing to get these people to then speak to their children? Because you get that a child grows up and that they turn 18, and then so before they turn 18, no one is talking to them about HIV or protecting themselves, But at 18, they're supposed to be making the right decisions about their lives.
And so nobody spoke to
no
them
information.
And you kind of want to bombard them with information at 18 when it might be a bit too late for some of them.
It's probably a bit too late. If you listen to conversations, there's a lot of conversations, like people are talking about sex, young people, all over the place. But information is lacking. There's misinformation is lacking, and there's also stigma issues around HIV. People are still a bit like, because they do not know as well, so they're not well informed. So then they are not too clear on what the issues around HIV are. We even have young people, especially in the more rural setups, who feel that, if I get HIV, chukua tu kamba, that's it.
So there's still that level.
So there's still that level. So you see, whereas the people who are okay if they get HIV, there's the ones who are like, if I get HIV,
my life has ceased at that point. Dr. Alwa, 1.4 million tested is a big number in our population. Tell me this, how difficult would you say it is coping with HIV/AIDS in 2019 as compared to back in 1999? What is it like for those living with HIV/AIDS?
Well, having worked and seen a lot of them as a specialist, tackle HIV.
What do they tell you?
Right now, things are definitely better. The issue of stigma, as Rebecca has brought out, is still a real issue. So it depends on where they are, and it depends on the context. Right now, especially for young people, part of the strategy is to provide psychosocial support, and that makes it easier to handle. When the family is supportive, when the community around you is supportive, then the person living with HIV has more zeal to live and to reach their potential. So as we're waiting for Baridi, he's one of those who have actually shown that living with HIV is not my identity. My identity is who I was born to be in this country and what I can achieve. So if we look at issues over time, the stigma-related issues do affect how one lives with HIV. And one of the things that we concentrate on is positive living. And positive living doesn't mean I concentrate on my HIV only. I will actually encourage a patient or a young person to take their medication, adhere to their treatment, get the care that they need so that they can reach their full potential. So we are actually seeing better potential. And we're seeing, you know, right now with ARVs, people, you can't tell who has HIV, and that's what the young people are also saying. That
so would you say, and I don't know how to word this properly, I hope I get this right, the fear factor of HIV/AIDS that would cause you to, I mean, when you'd walk up to an audience 10, 15 years ago and say you're coming to talk about HIV/AIDS, the way they would listen to you attentively, is that still the situation now? Or do you now kind of get a feeling that people are more laissez-faire about it?
Well, I think...
When you address forums and so forth.
I think people are more accepting.
Are more accepting,
yes.
Okay.
People are more accepting right now. In a few situations, you will actually see, and it depends on where you are, those who will still be fearful about the situation. And we've had situations where even with all the information that's available, people are still scared that I have this person living with HIV here, I need to give them their own cup, their own spoon, and that is still existing in our country, and we still need to address the issue of stigma. But I think there's more acceptance over time on the issue around HIV.
Okay.
Yeah.
So, Rebecca, there's a very tricky balance here. Are there certain realities that we are not alive to? For example, the economic situations of the young people, because some of them said that I did not engage in this unprotected intercourse because I wanted to. Yeah. It's because I didn't have a choice.
Yeah.
And many people, the first thing that comes to their mind is to castigate them and to tell them, no, everybody else has other choices, you just picked the wrong one. Are there certain realities that we are not alive to today that are facing the young people and also leading to these soaring numbers?
Yes, I agree with that sentiment, because it's more than just a health issue. It's really more than just, when you talk about young girls or even young men who are in relationships that they don't really need to be in, where they're being their sexual behavior is then risky. It's not because, some of them it's because there's peer pressure. So my friend has the latest phone, why can't I? And there's this older guy who says he can get it for me at her. If I just sleep with him without protection. There's the one who just wants to pass her exams and it's become really difficult. So there's a lecturer in school and then, you know, or they don't have any jobs and they're trying to take care of themselves. They want to take care of their families. They're probably the sole breadwinners. So then what other options are there for you except what is a risky sexual behavior? So yes, I do agree that young people are engaging in sexual risky behaviors because there is no other choice. Yeah. And given that, then you need to understand why prevention is everyone's business. It's not just the health business. It's not just for the people in hospitals, and because if a young person is able to access a condom, so we've done our job as the ministry, yes, we have ensured they have a condom in their hand, but we haven't given them food, we haven't given them an education, we haven't given them employment, and they have this condom in their hand, then what? Yeah. You
don't address the main concern. But then what is the strategy? Because you're the program officer at the National AIDS Control Council. What is the strategy going forward to ensure that this risky sexual behavior is put at a minimum?
Okay, so currently what we're doing is ensuring that, because the NAC mandate is to have a multisectoral approach towards HIV. So we're not just engaging with the people in the health space. We're making sure that we're speaking to the Ministry of Education, just like she mentioned, making sure that the curriculum actually has content. We're making sure we're speaking to labor and social services and child protection services, and we're making sure that young girls and young boys are protected, making sure that we have cash transfer programs, making sure that we are getting young people to also lobby for themselves, even at county level, through public participation, that there's money and resources for AYP programs so they can be able to get cash transfer programs, get employment opportunities, that they're able to build themselves, that it stops then being just a health problem. And I think that's why NAC as a structure is very important, because we're able to speak to other sectors that are working with young people, so that everyone is involved in this prevention business.
Everyone is involved, okay. Yeah. Dr. Alwa, tell me this. There are two groups that are influential in how maybe a large section of Kenyans make their decisions. One is the hard to identify grouping of African culture, because a lot of people argue what is actually African culture, but for many they say their thinking comes from either what their grandparents taught them or their parents, etc. A second grouping is religious groups. How would you say both groups have interacted with the threat of HIV/AIDS, and have perceptions changed over time? Have they been allies in the fight against HIV/AIDS, or have they caused roadblocks? What's the situation right now when you think of those two groupings or schools of thought?
I think that's a critical question. How much of the community is involved? And if you look at what the we have religious leaders who have been with us, working with us in the whole fight for against HIV and AIDS.
Were they with you from the beginning?
Well,
what was the first?
Well, I came later in the response, but from what I understand is without proper information, then you won't get people on your side. Okay. So when we go with the facts and when we go with the statistics, when we go with information, that this is your congregation, and this is what is happening to them. They've also been observing, and we have some very influential religious leaders who have actually seen that I keep burying my congregation. Why am I burying them? Then they be part of the response. So we do have more engagement with both religious leaders and the cultural settings. I think in some settings we've also seen that by engaging with the gatekeepers, the community gatekeepers, then you actually get improved response.
Okay.
So when you talk about issues like FGM is an issue in some parts of the country, and if you talk about the risks that also come along with using unsterile material, or even in circumcision or circumcising communities, if you're using unsterile material, then the risks of HIV are there. Then by educating them, then we also see that they actually get on the bandwagon and be part of the response in terms of reducing.
Okay. So they're actually willing to go against cultural norms.
So
you're seeing
so there is compromise and creating balance. But balance with information.
Okay, Dr. Lord, I'd like you to hold on that thought. Let's bring in Rogers from Molo. Is calling us in. Rogers, good morning. Yes, good morning, Rogers. Go ahead with your comment or question.
The issue of HIV and new infection.
Yes.
There are several factors that I can say are contributing to the same.
Okay.
Like there's a new intervention that they came up with, like the issue of PrEP.
Yes.
And PrEP, young girls are being exposed to PrEP and they start taking their PrEP.
Yes.
And they are non-adherents to PrEP. And they believe that when they are on PrEP, the infection cannot occur to them. And that's that's one factor. And then being an HIV activist from Homa Bay, one factor is poverty level, whereby we have teenage mothers and they are looking for maybe food on their table, and this is where they come in and get HIV.
Okay. Thanks, Rogers.
Very insightful.
Very
Rogers.
direct and straight to the point. So
we need more callers like that.
Pre-exposure prophylaxis. There is it. The scientific.
In layman's language, who can just explain to us what that is? For someone who may not have heard that term. Is it that hard?
So pre-exposure prophylaxis.
Yes.
When somebody is at risk and they need to understand what their risk is. So for example, if I could just give an example of a sex worker.
Okay.
Somebody who is consistently at risk but is HIV negative, then they're given pre-exposure prophylaxis. It is medication. It is still similar to the ARVs that we give for treatment, but to prevent any infection. Now, PrEP does not mean that you do not use other preventive measures. It should be used in combination with other preventive measures, and that's what we really need people to understand.
But Roger says there are some who think that once they're on PrEP, they're invincible.
Yeah. So it's not a magic bullet. That's what people need to understand. It is not a magic bullet. It's just part of a combined effort in terms of prevention. So still use your condoms, still play it safe, reduce your risk in terms of your behavior. So there are other things that need to go in.
So this is medication taken before, after, during, how long?
You take before.
You take before.
Before, and then you continue taking after the act. So it's not... in my opinion, you need to first, just like she said, have an understanding of what your sexual risk actually is. And you have to stay consistent because, and I like to tell young people who have sex, who are at risk, when they talk about the sex that they have, is it planned for? or is it not? And a lot of young people, it's never planned for. It's either I'm out today and then, you know, I have sex with someone, or I was going to class and then, you know, class bounced and then something, you know. So it's not something you can plan for. And so for PrEP, people need to understand that you have to take it before the act.
How long before?
7 days before the act.
7
days, yes. And then another 28 days after the act.
After.
So when you think about that, and you're talking to a young person,
even that math is too
like,
complicated.
How many of us actually finish our malaria
antibiotic treatment?
Yeah.
But also, how many of you plan 7 days in advance to begin with? You don't even know where you will be.
So, and that's why it's just like she said, if you know you're at constant risk. Yeah.
So something people just keep taking.
So you just keep taking it, just like you take your what is the contraceptive pills, like that. So you just make sure that you're taking it, because otherwise then it does not work, and then you're feeling invincible. You're really not.
From a knowledge perspective, how effective? What have studies shown about PrEP? How effective is it if well handled? And then we need to take that break after this.
Maybe they can tackle that when we come back.
Okay.
We have to take a break right now. But keep your feedback coming. You can also call in, like Rogers gave a very interesting perspective. His issue was PrEP and poverty levels. We'll delve into that in just a bit as well. But keep your views coming. We'd like to know, how do we prevent new infections of HIV from your view? What's going on? What did we miss? Because now 22 adolescents are contracting HIV every day. 6 of them are dying daily. We'll be back in just a bit.